Here we are drawing the posterior aspect of femur, lesser trochanter, greater trochanter, tip of the greater trochanter, head of the femur directed medially, upward and medially. Cruciate anastomosis and trochanteric anastomosis. At the root of the greater trochanter, cruciate anastomosis, and in the trochanteric fossa, it is a trochanteric anastomosis. So medially, it is a medial circumflex femoral artery. Laterally, lateral circumflex femoral artery. So lateral circumflex femoral artery has a ascending branch, transverse branch and descending branch. Medial circumflex femoral artery has a transverse branch and ascending branch. The superior gluteal artery and inferior gluteal artery that lies in the gluteal region posteriorly, and also the lateral and medial circumflex femoral artery goes to the posterior compartment by winding around the muscles. So inferior gluteal artery gives branches to the trochanteric anastomosis and cruciate anastomosis. So superior gluteal artery gives branches to the trochanteric anastomosis. So medial circumflex femoral artery gives branch to the acetabulum. So it has a acetabular branches. Now the profunda femoris artery, branch of the femoral artery, it pierces the adductor magnus muscle and goes to the posterior compartment. It has a 4 perforating artery. This perforating artery has a ascending branch and descending branch. So it pierces nearer to the linea aspera. So midline, posteriorly, it is a bony prominence. It is a linea aspera. So cruciate anastomosis is formed by transverse branch of the medial and lateral circumflex femoral artery, ascending branch of the first perforating artery of profunda femoris artery, and branch from the inferior gluteal artery. So it is formed by the 4 arteries. Now trochanteric anastomosis, it is formed by the ascending branch of the medial and lateral circumflex femoral artery, branch from the inferior gluteal artery and branch from the superior gluteal artery. It is also formed by the 4 branches. Trochanteric anastomosis. Third anastomosis is spinous anastomosis. It is formed around the anterior superior iliac spine. So it is formed by the branches from the superior gluteal artery, branch from the ascending branch of the lateral circumflex femoral artery, ascending branch of the lateral circumflex femoral artery, and branches of the femoral artery, that is the superficial and deep circumflex iliac artery. Superficial and deep circumflex iliac artery. These are the branches of the femoral artery. And branch from the iliolumbar artery, that is a branch of the iliolumbar artery, it is a branch of the internal iliac artery. So spinous anastomosis, it is formed by the branch from the superior gluteal artery, inferior gluteal artery, superficial and deep circumflex iliac artery, and iliac branch of the iliolumbar artery. Spinous anastomosis around the anterior superior iliac spine.